Hi there, and welcome to The Public's Health, the show that puts you, the public, back into public health. I'm Dr. Tony Iton, your host. Today we're going to be talking about a subject that is probably of great concern to you. It's certainly gotten a lot of media attention. Avian influenza, or bird flu, has killed people in various countries around the world, and it has certainly infected a lot of birds, some of which are migratory birds, and the expectation is that eventually it'll come to the United States. We're going to be talking about this subject from a slightly different perspective. You have a daily routine, the things that you need to do to continue your daily lives. You need to go to work. You need to get food. You need to use transportation. Your children need to go to school. And finally, many of us need to get health care. We're going to be talking about this subject from those perspectives. How do you maintain your daily routine? During a circulating pandemic, when the virus is in our community, we're going to have concerns about coming into contact with strangers, people at the grocery store, people at the pharmacy, at the post office, at a variety of different places where we might feel that we could be exposed to the virus. This show is going to talk to you about some simple precautions that you can take and give you a little bit of knowledge about how you can avoid becoming infected by just practicing simple respiratory hygiene, hand washing, the kinds of things that your grandmother always taught you. We're going to talk to some experts, and we're going to see some different settings in which precautions are being taken and planning is being done to try to minimize the risk of exposure in these settings. We all need to do these things. We need life to go on during a pandemic. We hope that this information will help you, help us, keep as many people healthy and safe throughout this pandemic. Thank you. Hello there. Today's theme, transportation, as you've heard. And we're joined by Casey Wilson of Bike Alameda. Thanks for joining us, Casey.
You're welcome. Thanks for having me.
So during a pandemic, we may not want to get on the bus. We may not use our typical modes of transportation because we're concerned about getting close to people. So tell us a little bit about some alternative approaches.
Well, the first thing that comes to mind is obviously walking. If you live near a school, it's easy to walk there. But some trips, are longer. Some trips might be 5, 10, 20 miles. And it's not really fun to walk that distance, but it is fun to bicycle that distance. So cycling as an alternate form of transportation can be a good choice for a lot of people who are trying to avoid crowded situations, such as maybe sitting on BART or maybe sitting on AC Transit where the guy next to you might be coughing. When you're on a bike, chances are you're probably not going to have someone next to you who's hacking away, and you're also going to be having a lot of fun, as well as increasing your immune system and getting some fresh air, which is always great when there's a sickness going around.
Great. Anything that people should know about how to get plugged into biking as a way of transporting themselves?
Most definitely. Anyone interested in finding information out, such as maps of the area, the East Bay area, or information on cycling classes that can teach you how to ride safely, can go to www.bikealameda.org.
Okay, biking, that's one way to do it. But if you can't bike, you might want to use public transportation. Next, we've got Linton Johnson, the chief spokesperson from BART, to tell us a little bit about what BART's got in mind.
Some masks are works of art. Others are for fun.
Some masks protect you. Others protect those around you.
Airborne droplets from your cough or sneeze can expose others to influenza.
Use tissues to cover your cough. And if a flu pandemic arrives, please cover your cough with a mask.
For more information about pandemic flu, visit pandemicflu.gov or ACPHD.org. Brought to you by the Alameda County Public Health Department.
Well, we've heard about some alternative modes of transportation and some strategies that you might want to adopt to get to and from work. Well, we all have to get to work, and some of us use public transportation. We're joined now by a special guest, the chief spokesman for BART. Welcome, Linton Johnson.
Thank you.
Linton, I take the BART a lot. I get on the BART sometimes during rush hour and it's crowded. There are people pressed up right against me. Sometimes people are coughing. Definitely I have to hold on to the hand railing. I'm concerned. During a pandemic, I might be putting myself at risk by getting into public transportation. What are some of the considerations that BART has taken to try to mitigate that risk?
Well, first of all, what we're trying to do is make BART cleaner, and that's regardless of whether there's a pandemic flu. What we're trying to do is make BART cleaner, and one of the things that we're working with is a partner who is going to help measure the germ load on BART and help bring that down, provide us with some expert opinion on what type of products we can use to make BART cleaner, cleaning the trains, such as the handrails and that type of stuff. The other thing we're going to do is offer our passengers a way to be able to improve their own hygiene. That'll be anything from perhaps giving out some sort of handy wipes or maybe some waterless stations where you can go and put your hand underneath there and get some gel that'll disinfect your hands before you go through the fare gates or after you go through the fare gates. We're working with the partner to figure out what the best way of doing that is and helping our passengers become more, have better hygiene. So that's one of the first things that we're going to do to help BART get cleaner. And then if there is a pandemic flu, we have a comprehensive plan in place whereby we're going to be communicating with our passengers as well as our employees on what to do in case there's a pandemic flu. That has not been completely developed, but we're furiously trying to get that together right now.
Oh, great. So BART is really taking this quite seriously. Now, you are a major part of our infrastructure.
Yeah,
Without BART, when BART shuts down, we know that a lot of other things that are dependent upon BART and moving people back and forth is also imperiled. Now, BART also has to look at continuity of its operations when some significant portion of its staff may be out sick with pandemic flu. How have you looked at this situation?
Well, this is very complicated because you have no idea just what portion of your staff may be going out sick. But we are looking at different plans whereby if a third of the staff goes out sick, what do we do and how do we maintain minimum operations? Or if a fifth of the staff, we're looking at all types of levels and trying to fit a plan that fits those levels. And of course, if it ever happens, I'm sure it'll never fit the plan that we've been planning for exactly, but at least we'll get close. We also are looking at ways of helping people work from home, setting up the IT infrastructure so that way people can log in from home and access their files from home, still get the work done, but not be around as many people in the building at BART and reduce the chance of people getting sick.
Great. So clearly taking this very seriously. So what's your message to the public? Should we take BART in a pandemic?
Well, I hope people do take BART in the pandemic because I believe that we're going to be able to provide people with safe transportation. That said, there's a risk to everything. And I think what I would highly recommend is that we're going to recommend is follow your gut instinct and do what you think is best for you. We're going to do everything that we can do to make it as safe as possible, but the bottom line is you're going to have to follow your gut instinct. But we are going to try to make it as clean and as safe as possible, but it's also going to rely upon the customer as well, simply because people have to practice good hygiene, and if they don't do that part, if they don't do their part, then we can't do our part.
Thank you, Linton Johnson. And now we're going to move to a high-risk setting, ambulances. Well, we've talked about some innovative strategies in transportation, and we've talked about public transportation and some of the concerns there regarding pandemic influenza. Now we're going to move to a high-risk setting. Ambulance drivers, paramedics, emergency medical technicians are dealing day-to-day with transporting sick people between hospitals, from home to hospitals to nursing homes. And we're joined by a real expert in the training and education of paramedics and EMTs throughout Alameda County, Gail Porto. Welcome, Gail.
Thank you very much, Dr. Iton.
Gail, tell us a little bit about what you do.
Well, I'm the Quality Assurance EMS educator for several fire departments in Alameda County. And in that role, I am responsible for continuing education for these folks, which we do on a monthly basis, as well as quality assurance. And that's a fancy title to say that I review all of the calls that they go on for appropriateness of patient care.
So you're a real expert. You're dealing with them on a daily basis and helping them protect themselves from injury and illness in their work.
That's what I try and do, yes.
Tell me about some of the things that you train EMTs and paramedics in order to protect themselves from respiratory diseases.
We teach universal precautions, and that is based on the fact that multiple patients are contagious, and we would have no way of knowing that. And so the assumption is every patient is potentially contagious. And to that end, we use universal precautions, which mean you wear gloves with all patients whenever you're coming in contact with patients. If there's a respiratory ailment, coughing, sneezing, you would put a mask on the patient, mask on the paramedic at sometimes. If there was a chance of splashing of bodily fluids, they have gowns to wear. Also, plastic face shields that would protect them if there was a chance that they would get something splashed in their face. Besides gloving, they're very particular about washing hands immediately after removing gloves. Washing hands with a particular solution that OSHA approves that they have in a foam dispenser in the back of the ambulance. Mm-hmm. And then they also have the bactericidal, fungicidal solutions that they use to wipe down the back of the ambulance in the event that there's any contamination.
It sounds like they're quite well protected and quite well trained in the use of those modalities to protect themselves. Now, during a pandemic, we're obviously very concerned that the ambulances keep running and that people show up to work and they're able to transport people, because we'd like to make sure that our society, the critical aspects of our society, are maintained. Now, during a pandemic, we would have to make decisions about who got vaccine if we had vaccine available. And paramedics would be first on the list to get, paramedics and EMTs would be first on the list to get that vaccine. Have those kinds of questions come up when you're talking about pandemic influenza?
Actually, that's been the major concern that these folks have had. Understanding what precautions they need to take was put to rest pretty quickly. But the concern is, will I be in line to get the vaccine? Will I be one of the people getting sick? What about my family? Do I have to worry about them? Who's going to take care of the children if my wife gets sick? So all of these issues were major issues, recognizing that they'll be on the front line dealing with these folks.
Well, and all the schemes that I've seen for prioritizing the vaccine, and that assumes that there's vaccine available, but the paramedics and their families and the EMTs are considered first responders and would get vaccine as a first priority. They're very critical, and we're so glad that you're working with them to help us help them continue to support us.
That's great. That will be a relief to them too, because they want to get out there and help.
Well, there you have it. So we've heard from experts now in all manners of transportation, and now we're moving on to another area, schools. Thank you, Gail.
Thank you.
Well, we're back, and we're on to a very important subject now, schools. During a pandemic, it's estimated that some 40% of preschool and elementary school children will become infected with the influenza virus. So schools are a critical location to do planning and prevention. And we're joined now by Sheila Jordan, the superintendent of the Alameda County Schools. Welcome. What are the three things that parents need to know about what schools are doing to prepare for pandemic influenza?
Well, first, let's say this is an ongoing discussion, and it's a preliminary discussion because we're just starting in schools to think about these issues, thanks to you. But we all know it's important, and I think the issue of wellness as a prevention strategy is very, very important. What does that mean? It means that we emphasize with all children, particularly our youngest children, that there are healthy habits. Cough and sneeze into your elbow instead of into your hands. Wash your hands. We have to make sure that the schools have the supplies that they need in terms of soap and towels and tissues. And finally, we have to reinforce the policies that already are on the books. Don't come to school sick. Don't send your child to school sick. And we need to give support to parents so that they understand that and that they don't starve to death in the process. I mean, we need to work on child care solutions as well.
That's great. Now, in the unfortunate event that we have to close schools because we're concerned that the pandemic may be worsened by allowing the virus to circulate in schools, what kind of steps have the schools been taken to prepare for that? What innovative things have you been thinking about?
Again, I think it's really important to emphasize that the schools are just starting to deal with pandemic in the future. And, you know, again, we've looked to you and your department to provide leadership in that. You know, the good news is that the strategies that we will employ are already strategies that schools are involved with, mostly around technology. Obviously, for younger children, we'll rely heavily on television, and our cable TVs will be very, very important. The older the children, the better access and the better opportunity to use the internet. I think it's very important that we work with families, that we look as a county and as a state to universal internet access, and that's something that makes sense anyway, and that we get our best minds working on identifying appropriate software and really stressing the interactive kind of work that we've already been starting to do, particularly with long-distance learning. Obviously, that's not ideal. Nothing replaces a teacher and a child, but in case of the unfortunate circumstances of actually closing down schools, we need to be prepared.
So a lot of work to be done, but a lot of good thinking has already started. So I'm a parent, and I'm concerned now about how I can get involved in the planning and what plans my school may be doing. What should I do as a parent now?
Well, I would suggest that not everybody start calling the school, but I also would suggest that concerned parents raise this at their school site level and feel free also to raise it at their school board level. I think it's important that the dialogue begin and continue. How are we prepared? What are we doing on prevention? What should I do? What is the school doing? What does communication look like? And how can we reinforce what you're trying to do in schools?
Thank you very much, Superintendent Jordan. So, there you have it.
And now, another episode of Pandemic Detective. Today's episode finds the investigator on the Oakland waterfront.
The suspect in this case is Vi, the virus. Let me dish out the facts. She's small and very dangerous. She travels around the world now and then. She likes birds. She might learn to like you. I'm watching for her. The health department's watching. If Vi the virus shows her ugly mug, we'll be ready. So cover your cough, wash your hands, and keep your eye on Vi the virus.
Brought to you by the Alameda County Public Health Department.
Well, from the superintendent of schools to an expert on school health, we're joined now by Joan Edelstein, the school health coordinator for the Oakland Unified School District. Joan, thank you for joining us.
You're welcome. It's nice to be here.
Now, I have kids, and I certainly know when they get sick, their noses are running, they're wiping their hands, they're wiping it on whatever they can find to wipe their hands on. And certainly when they go to school and you get a room full of these kinds of kids, that's a recipe for some real germ sharing. So as a school nurse and the school health coordinator for the Oakland Unified School Districts, what kind of things are you working with at the schools to ensure that kids get a sense of what they need to do to minimize the spread of germs?
Good questions, Tony. Actually, in Oakland, we're very fortunate to have just passed a wellness policy, the point of which is to help to improve and maintain the health of our students across the board. And one of those areas that we're looking at improving is health education. Of course, as you know, health education is extremely important in minimizing the risk of the spread of disease. So looking at teaching young children in particular to wash their hands well, to cover their coughs, to stay home when they're sick, and also teaching parents to keep their children home when they're sick so that they're not exposed to other children and bring that illness home.
Well, you're certainly not going to have to teach my kids to stay home when they're sick. That's the first thing they want to do.
Oh.
But you're right, that it's sometimes difficult for parents to understand why it's important. My kid's got the sniffles one morning. I think, it's just the sniffles. I'll send him to school, see how he does. How are you educating parents not to necessarily do that when they don't want to have to figure out how to take care of their kid at home?
Well, that's a challenge. We have to communicate with parents effectively, and it's always important for parents to be involved in their schools and know what's going on with their children's schools. We can send letters home if we have a nurse at the school, and it's always a wonderful advantage for all students to have a nurse at the school, particularly when it comes to contagious diseases, because the nurse is the first person who can identify early signs and say, this child does need to be sent home, rather than sending a child back to the classroom because, well, I don't know what to do, or I can't reach the parents, or I don't know who to call. Another way that we can really reach parents is for parents and guardians or any family member who's responsible to complete those emergency cards that give us information about a child's health needs and how to contact them if the child is ill. And that also means coming in and updating the information if there's a change in phone number or a change in address, so that we can make sure when we want to call or send something home that we can actually reach the families.
Ah, so that's basic information, but important.
Yes.
Now, if I'm a concerned parent and I think, I want to find out what my school is doing, first of all, do I want to go into the principal and say, do we have a school nurse? What's the school nurse doing? I mean, does it make a big difference to have that school nurse in the building?
It does make a difference to have a school nurse in the building. We know from research that students who have school nurses are healthier in general. They are in school more. When they are ill, they're sent home, they get better health education because there's someone there to let them know this is how to wash your hands. There's someone to be checking on vital hygiene measures, such as checking out to make sure that the bathrooms are stocked and supplied, that there's soap, that there's paper towels, to make sure that whatever they're taught about hand washing, they can follow through with and feel that they can be successful in preventing the spread of disease.
And what about kids with asthma?
Very important to really take good care of our students with asthma. Over 15% of the students in Oakland have asthma, and one of the things families need to do is to make sure that they get a flu shot every year, because flu can be really serious for students with asthma, not just avian flu, any kind of flu. So a flu shot every year is essential.
And there you have it. Nothing more valuable than a school nurse. And now to Sue Johnson to talk about high-risk settings in schools and precautions being taken there. Thank you, Joan.
Sue, thanks so much for joining us here today. Why don't you start off by telling us a bit about the medical therapy program and the population the program serves?
Well, the medical therapy program is part of a larger program called California Children's Services, or CCS is known to many of our families. There are school-based clinics that provide physical and occupational therapy services to the children under the direction of their CCS physician. Their goal is to help the children to be as independent as possible in his or her environment. We work very closely with the school and the families and provide consultation services to the teachers and parents in order to help the child achieve that.
Okay, so this is a program that's based in the schools. What is the age of the population that you serve?
Birth through age 21, and these are children who have a diagnosis that creates a physical disability.
Okay, so our scenario today is that there is some kind of large outbreak, like a pandemic influenza or a large-scale disease outbreak that could impact the health and safety of our county residents. And for instance, if our health officer were to close the public schools where the medical therapy units are located, what would be the plan for delivering those services?
Well, certainly we would expect that the school buses would not be operating. So our staff would, under these emergency conditions, go to where the child is. And that may be in their home with the parents, it might be with a babysitter, they might be staying with relatives during this time.
And so this is a very customized delivery of services. How would you prioritize who gets services first? This is already a population that has many needs, right?
Certainly. We would give priority to those children who have had recent surgery. We would also prioritize the babies and the children who have been newly diagnosed. And then those who have emergent skills that need reinforcement in order that they don't lose skills in the process.
We want them to retain as much as possible. Okay, so we have a customized program that becomes even more customized. It moves from the school to the home. We already have the target population that we would continue to serve. We have a mechanism for prioritizing who receives services. How would you communicate all of these changes to the various audiences, the parents as well as the educators that you're working with?
Well, we would certainly get on the phone as we always do when we need to communicate changes with the families. But in addition to that, we would access our mailing list and send out newsletters to the families. We would post bulletins at the school site. We would leave a voice message on our answering machine in the unit. We would make announcements on the public health website and communicate directly with the schools so that in the event that the families were contacting the schools that they could relay the information about the changes.
And of course, since this is a state-based program, you would be communicating these changes to the State Department of Education and Health, right?
We certainly would.
So in such a scenario where there would be so much going on and so many concerns, what do you anticipate would be some of the challenges in communicating all the different shifts in the program to accommodate the emergency?
Well, certainly staffing would be the biggest issue we'd have to contend with. Our staff would have the same issues that our families having with the school closures, and some of them would not be able to leave their children at home. The public health department would work with our staff to create a plan to get coverage for child care during this time so that the staff are available to continue services. There will be equipment needs that we may not be able to get back into the unit in order to get some of our therapy equipment, but our staff are really good at adapting their treatment techniques, and certainly utilizing equipment at the home would only foster new skills in the home setting as well.
So all in all, this sounds like it wouldn't be a total catastrophe in as much as the program would continue. There'd be a mechanism, again, for prioritizing who receives services. There would be a way of communicating with staff, and the services would be adapted to the home. Would there be other key things you would want parents to know about this program, and if there were a major public health disaster?
Well, we would not be able to deliver services at the frequency that the families are accustomed to, but we would use sound professional judgment to ensure that that the children receive critical services and that they maintain their skills.
Okay, well, thank you very much for joining us today.
So we've heard about how you get there, and we've heard about how you get your education. Now to Dr. Bob Benjamin for some pearls of public health wisdom.
Thanks, Tony, very much. Another interesting segment on public transit and schools. BART's doing an awful lot in terms of thinking about how to protect their clientele, but it all boils down to the same stuff. Wash your hands, cover your cough. Do that often, do that every time, and the risk of not only transmitting to other people, but also acquiring illness drops dramatically. Joan Edelstein made a very, very interesting point about the need for flu immunization. I would stress that not only for kids in school, but also for adults. The other piece that I think was missing is that the schools will play a very integral part in our surveillance system for flu, because as soon as school absenteeism due to flu-like illness begins to go up, we'll know about it and we'll begin to take action. So, wash your hands, cover your cough, use public transit, ride bikes, but be clean about your own personal hygiene. Thanks again, Tony, very much.
Thanks, Dr. Bob. And there you have it. Join us in our next episode when we talk about another critical need, how to access health care. We hope to see you then. Bye-bye.